Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, January Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our guest is Darla Schwab, PT, DPT, with Altman Hospital. Good morning, Darla, and welcome to the show.
Good morning, Paul. Thanks for having me.
What is a PT and a DPT? You got to tell me because they didn't let me spell it out.
So PT just stands for physical therapist. So that's what my licensure is. Okay. And DPT stands for my education level. So I have a doctorate of physical therapy. So that's the DPT.
Holy smokes. How many years?
Bachelor's and then 3 years after that. So.
Wow. Okay. Good deal.
Everyone has a pelvic floor. It's made up of the muscles that support the urinary and reproductive tracts. This group of muscles also controls the bladder and the bowels. In women, the pelvic floor keeps your bladder in place in the front and the vagina and the rectum in the back. In men, the pelvic floor helps keep the bowels, bladder, urethra, and rectum in place. The pelvic floor muscles attach to your tailbone and pubic bone. If the muscles in the pelvic floor are weak or don't work the way they should, this is called pelvic floor dysfunction. This morning, we're going to talk with Darla about pelvic floor physical therapy and how it's used to treat pelvic floor dysfunction. We'd like to remind our listeners that today's program is available on our podcast. You can subscribe and download our podcast from your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy, and you can listen to our programs anytime.
So, Darla, welcome to the show again. Please introduce yourself and tell our listeners a little bit about yourself and your practice.
Okay, thanks, Paul. I've been a physical therapist for about 8.5 years, with the past 5 years being solely dedicated to pelvic health. I became drawn to this specialty after the delivery of our first child, and became acutely aware of how important pelvic floor therapy services is to our population, as well as the fact that there weren't very many providers available locally. So I sought to change that. About 5 years ago, I began extensive training, and now I practice within Altman Therapy Services at the Altman North location.
Okay, so what exactly is pelvic floor physical therapy?
So pelvic floor therapy is a specialty area of practice that offers treatment for conditions such as both urinary and fecal incontinence, constipation, pelvic pain, abdominal pain, pain with intercourse, sacroiliac or coccyx or tailbone pain, prolap, and we also care for musculoskeletal pain that women develop or endure during pregnancy as well as postpartum.
So I've never heard of this therapy before. Why haven't I guess?
So pelvic floor therapy requires specialized training after you graduate with a physical therapy degree. And that's not available very widespread to get that training, and it is rather expensive. But Altman offers the largest pelvic floor therapy here in Stark County, the pelvic floor program here in Stark County. We have 2 specialty trained therapists who treat pelvic health patients 100% of the time. That is our entire caseload. And we treat our patients in a dedicated space away from the general therapy gym. And these services have been available here at Altman for about 3 years. So providers and community members may not be aware that we're even here because it is a newer program available at Altman.
So how's pelvic floor therapy different from any other exercises?
So there's a couple different parts to that answer. So most people are taught to do your Kegels and that will help your pelvic floor. The issue is most people are never correctly taught how to properly isolate those muscles in the first place. And they don't address both kinds of muscle fiber that are present within that muscle. And people tend to use other muscles, like muscles in their bottom or muscles in their legs, and they hold their breath instead of using the right muscles. So if you don't use the right muscles, you're not going to see improvement of your symptoms. And the other part is Kegels alone will not solve problems such as incontinence or prolapse. There's a lot of other factors involved, such as core strength, muscle activation, ability to not hold your breath when you do daily tasks, as well as dietary contributions that should be addressed in order to fully address their issue and improve their quality of life.
Interesting.
Okay, Darla, if someone's been suffering for years with symptoms, can pelvic floor therapy be helpful?
Yes, and we get this question a lot. It's never too late to make improvements in the people's function, it doesn't matter how long they've been dealing with it. Oftentimes, people feel that incontinence is just a part of life after having children or getting older, and although those symptoms are common, they're not normal, and those are signs that your muscles and other tissues are not functioning the way that they should be, and this is true for both males and females.
All right, so you just mentioned getting older and maybe after pregnancy. I guess I'm wondering how common pelvic floor issues are. And I'm also wondering how many people just tolerate the issues thinking they're getting older and it's just something that happens as you get older.
Yeah. Approximately 1 in 3 women between the ages of 30 and 60 experience urinary incontinence on a regular basis. And for men, that number is 1 in 4. As people age and reach above the age of 60, that number actually increases to 50 to 60% of people who are living with incontinence daily. And that has a large expense as well. These people, they're buying incontinence products such as pads or liners that are not cheap. And then foregoing daily life events because of fear of incontinence. And pelvic pain is another part of a pelvic floor issue. And that includes 40% of women and 10 to 15% of males at some point in their lives. So the answer is it's really common. It's just not something you talk about.
Well, you just covered it. It's not something you talk about. I'm sure that being kind of conscientious is a big reason. Is that the most important reason why people don't, or most common reason people don't seek treatment, or are there others?
Definitely the most common reason people don't seek treatment, because you're taught not to talk about these things. You're taught that it's normal and to continue and go on with life. And unfortunately, that causes people to suffer in silence. It's something that a lot of people are afraid to talk to their physician about because they may not know that there are services available that can pretty easily and effectively treat their symptoms and improve their quality of life. So, but sadly, it does cause people to miss out on daily life and social activities because of fear of incontinence, but it doesn't have to.
Okay, so if someone's been diagnosed with a condition such as prolapse and offered surgical intervention, can this therapy still be helpful? And maybe it'd be helpful too, if you don't mind, for the listeners, if you talk about what prolapse is.
Yeah, absolutely. So I'll start with that. So what prolapse is, there can be several kinds of prolapse. So you can have prolapse of the bladder, you can have prolapse of the rectum, you can have prolapse of the uterus, and there's a few other ones, but those are the most common. So most women, if they have prolapse of the uterus, will undergo hysterectomy, depending on their doctor's advice. But bladder prolapse, or a cystocele is the medical term for it, is extremely common after vaginal delivery, especially. So women may feel a little bit of like a bulge at the opening of the vaginal canal, and that can be indicative of a prolapse. So the answer to can therapy still help if they've been offered surgery? The answer is yes. Improving muscle strength and coordination prior to surgery can still help prepare that person to have a better functional outcome following surgery. And I use the example with patients. It's just like if you were to need a knee or a hip surgery, say a replacement. Those people go to therapy beforehand, and then they also go after. So that way you can get the best functional return, but you're also going in with the best muscle function that you can prior to surgery. So it's the same concept. But if the grade of the prolapse is anywhere from a 1 to a 2, even into the 3, physical therapy can make a pretty good improvement of the symptoms. But if it's a severe prolapse, we can at least make sure that following surgery, they have the best recovery that they can.
So pelvic floor therapy for women only?
No.
I guess there would seem to be a complication with particular older men who might have a prostate issue. Where does this fit in the middle of that?
You're exactly right. Men and women both have pelvic floors. And we treat males, females, as well as pediatrics here at Altman. Men are typically seen for conditions, as you said, after prostate surgery, especially. We actually see some of them before surgery. So that way we can get the function as best as we can prior to surgery. But it's never too late either. Men who have had surgery 15, 20 years ago can still see improvement of their symptoms with pelvic floor therapy. We also treat men with pelvic pain as well. There's, as I said earlier, 1 in 4 men at some point will experience some amount of pelvic pain. So we do see pelvic pain patients. And for pediatrics, we address things like constipation management, urinary incontinence, and pelvic pain in pediatrics as well.
You got to kind of wonder about pain in that area, because there's so many other issues that for women and men, I guess, it could involve irritation, pain, whatever. How do we sort all this out?
Yep, that's the fun of my day. I use the example, you have many organs. So the pelvic floor, you have the bladder and urethra, so you're dealing with urology type symptoms. You have the rectum, so you're dealing with colorectal or GI. You're dealing with reproductive systems if you're dealing with females, so GYN or bacteriology if it's a male. But then you also have orthopedics in there because you have the spine and the hips. So a lot of times symptoms, somebody may be presenting with pelvic pain and it might be an issue inside the hip joint, or it might be incontinence that's being caused by constipation. So it's definitely a puzzle. And people have typically seen multiple providers before they're in my office, but there is help. It just can be complicated to figure out exactly where it's coming from.
I find this an extremely difficult thing to sort out if it's in that area. Being as old as I am, and the aches and pains and all that kind of stuff, it's kind of, how do you figure this thing out without having multiple tests and all that sort of stuff, On that, we'll take a break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Flu vaccine along with Moderna and Janssen COVID vaccine are available at the Medicine Center Pharmacy. So stop by any of our stores to get vaccinated. No appointment is necessary. So I don't know if we covered this or not. If someone is experiencing pelvic pain for a while, testing comes back normal for their providers, what else could pelvic floor therapy offer?
There are many factors, as we just discussed, that can contribute to pelvic pain from both inside and outside of the pelvis. Pelvic floor physical therapists are specifically trained to evaluate this and may be able to offer solutions to patients that have been experiencing long-term pelvic pain. The pain can be the result of many issues that are not just limited to things like pelvic floor dysfunction, meaning that the muscles are too tight and not functioning properly, or they may not be strong enough, resulting in them being overused, as well as things like constipation or tension in the abdominal wall, scar adhesions, and hip dysfunction, or even issues within the spine can cause pelvic pain. So that's where physical therapists are uniquely trained to be able to evaluate all of these aspects that can contribute to pelvic floor dysfunction or pelvic pain.
So where is treatment provided at?
So our pelvic floor team is located at Altman North, which is on Whipple Avenue in North Canton. And when patients first arrive, their initial paperwork is completed in the general therapy gym. And from there, they will be met by one of our pelvic floor therapists. All visits are actually in an area away from the general therapy gym. We just meet them there. They do their initial paperwork downstairs. Treatments are one-on-one, and you do remain with your therapist for the duration of your care.
So how do you schedule appointments, and does insurance cover this? I'm assuming you need referrals. Can you touch on those details?
Absolutely. So pelvic floor physical therapy is actually billed the same as regular physical therapy. It's a question we get from a lot of patients. They'll call their insurance and the insurance hasn't heard of pelvic floor therapy before. we bill the same treatment codes as you would if you were coming here for a knee replacement or something along those lines. And because of that, any copays or deductibles that you would have for typical physical therapy care does apply. So everybody's plan is different. So it is best to directly speak with your insurance company anytime you seek care, just so that way you can understand your benefits and what out of pocket you may have. Altman is in network with most major insurance companies, including Medicare and Medicaid products. So, and you can definitely call and find out before an appointment to make sure that we are in network, and call your own insurance. And our pelvic floor therapist here, myself as well as Samantha, are the other pelvic floor therapist here. We do offer direct access now, which is newer in the past several months. So we are able to see patients with pelvic floor therapy without the need for a physician referral. Patients can still have a physician referral. That's completely okay, but it's not something that they have to have. And for scheduling, they can just call the Altman North location. The phone number is 330-244-8113. And we do have appointments that are available Monday through Friday, and we do have evening and early morning hours available on some days to help try to make it work for people's schedules.
So the follow-up question to that might be, how often do patients come in for treatment?
So the answer to that is it depends. This is variable, and it will depend on what condition the patient is coming and seeking treatment for. At most, the patients are seen once per week, and we focus on trying to give our clients home programs so they can do as much as they can in the setting of their own home. So that way we can spend the time that they're in our office focusing more on one-on-one care that they can't complete at home. We understand that the patient's time is very valuable, so we try to treat your condition as quickly as possible. Most of the time we are seeing our patients 10 visits or less if it's an uncomplicated case, which people like to hear, that it can be treated pretty quickly. But your therapist will work with you to develop a treatment plan with the patient's goals in mind and their schedule in mind as well.
So how long are the visits?
So
would suppose they vary depending upon the individual.
Right. And they do. The first visit is always about an hour. So your first visit's what we call your evaluation. And that's an hour with your therapist. So you also are asked to arrive anywhere from 15 to 30 minutes early just to complete paperwork. So that way we have the full treatment time available to spend with the patient. And follow-up visits, they vary anywhere from 45 minutes to an hour, depending on the patient's needs.
And the patient should wear what for the first visit?
So comfortable clothes, loose fitting clothes, tennis shoes. It doesn't matter. We'll make it work. But if they can, it does make it easier if they can wear something that's a little bit more comforting.
Shorts and 20 below zero? Is that...
Not quite shorts. Loose fitting, but we won't quite go to shorts.
Okay.
You can if you want to.
I had a test up there the other day, and they said wear shorts, and it was like 30 outside. And like, come on, how the heck do we come out the door with shorts at 30-degree day?
Right.
So anyway.
All right. Well, what about this? Can patients bring someone with them, and can that be helpful?
Absolutely. Patients can bring someone with them if that makes them comfortable. We also have a waiting room if the patient would like to accompany you and then step out for any aspect of the examination. Because of COVID, Altman North follows the same visitation restrictions as the main campus, meaning that we're asking that the patient brings no more than one visitor at a time. And just be aware that this policy is subject to change based on the pandemic. So that may change or it may not change. But as of now, just one patient or one visitor per patient.
Okay, Darla, it's the bottom of the hour. Time for the news. You're listening to Health Matters with the Medicine Center Pharmacy. This morning, we're talking with Darla Schwab from Altman Physical Therapy. So we have a lot more to cover this morning. Let's get back to the show.
Okay, Darla, we haven't talked about other modalities of visits. Are telehealth visits possible?
Yes. So most insurance companies do allow telehealth visits following the initial evaluation. So after that first visit, they do not allow us to see patients for the first visit electronically or via telemedicine. And if this is something that you are interested in, it's best to discuss this with your therapist at the first visit. It is important to realize that not all conditions can be effectively treated via telemedicine, but it is a great option for some patients as an added aspect to their care.
Okay. So, I guess I'm trying to think about how your daily therapy visit would go. What would a patient want to bring with them to make sure they're set up for success?
So for the first visit, if their physician provided them with a referral and we haven't already received it via fax, it's good to bring that with them. That can give us some additional information about any other medical procedures or testing that they may have had done that they may be bringing with them from their physician office, as well as their insurance card and their medication list.
Okay. Can you give us maybe an explanation of what a garden variety visit would look like and what you'd have the patient do? I guess I'm trying to envision, I'm sure it involves some different exercises and things, but maybe since this is a topic that a lot of patients don't like to talk about, maybe you could give the listeners an overview of what a visit they might experience.
Right. So the first visit, once they come in, they'll arrive to the therapy area where they'll complete intake paperwork. So that allows us to better understand what symptoms the patient is experiencing, and it allows us to kind of hone in during their evaluation time so we don't have to ask a bunch of questions that might not be related to what symptoms they're having. So it might seem like a little bit of paperwork, but we try to keep it mostly circles and X's, but then it allows us to really hit what symptoms are bothering them the most. And then once these are completed, the therapist will meet them and bring them to our private therapy area and complete the evaluation. So this includes a comprehensive history. So as we talked about earlier, there's a lot of contributing factors to pelvic floor dysfunction. So we have to go through several systems to make sure that we're not missing something. So that history is going to be a little different depending on each patient and what they're arriving for. And no two evaluations look the same because every patient is coming in with different needs. So the therapist may examine the abdominal wall, check for any issues there, any scar tissue, any abdominal muscle separation, depending on your history. We also may look at hip strength and look for any other issues that may be abnormal. We also may look at the lumbar spine. It can contribute as well. And as specialized therapists, we are trained in completion of pelvic examination. So this examination is different than what you would expect at the OBGYN or the primary care physician. We do not use speculums or stirrups with our pelvic exam. In our exam, the focus is to look at the muscle tissue and to see how it's functioning. It should be painless. But this examination does not have to be completed on every patient. And it doesn't always get done on the first visit. So this is something that a lot of times when patients come in for that first visit, they don't know what to expect. There's no cookie cutter visit. It's come in, let's talk about what's going on. Let's make a plan to fix it. Some patients are ready to go with that pelvic exam. They're ready to get it taken care of. Other patients would prefer not to do that, or they prefer to wait a little longer before we do that. And all of that is fine. We meet the patient where they are, and we go from there. And then the follow-up visits are very similar. They're given instructions on how to get to our area. They don't have to wait downstairs like they did from the first visit, but then the treatments are custom tailored. So it might be exercise based. It might be some hands-on and exercise based. But that's very, very variable depending on what that patient is coming in for.
So in evaluating the muscles, would you use how do I see? I had a test for my hand last week because I have a problem with my left hand, and they use a stimulus, electrical stimulus, to check the nerves and the muscles.
Yeah.
Would that be a test that you would use for this?
Not that exact one. So it sounds like you're talking about a nerve conduction study.
Yes, I guess.
We do something similar. So if someone is having trouble finding how to find the muscle, so say we have someone comes in who may have a lot of trouble isolating the muscle. As we talked about earlier, if this muscle is very weak, a lot of people will try to use other muscles to help substitute. So they may squeeze their legs together. They may try to hold their breath or squeeze their bottom. So we have a tool here that's called Surface Emg. So it's similar to the nerve conduction study, but what we are looking at is how much electricity can be generated from a muscle contraction. And that doesn't measure muscle strength, and that's something I always explain to my patients, but it does help me. So say you come in and the first time you try to contract the muscle, you can only hit, say, 6 what we call microvolts. So as we work, it's a nice quantitative tool that we can use, because as I check that later, that number might be 10, 15, 20, as they're better able to isolate that muscle. And it helps because it also has a visual aspect to the tool as well. So as patients are able to isolate the muscle, the number goes up on the monitor. So they're able to see, yes, I'm contracting the right muscle, and this is how much I'm able to. And we are also able to look at how well they're able to turn that muscle on and off, as well as how long are they able to hold it before we start to see reduction of the muscle activation, which is cool because you can't feel that with your finger, but you can see that on the monitor because it's measuring those microvolts. And then along with that, with treatment, so we call that biofeedback, or the Surface Emg. That's a tool that does not fix the problem. All it does is it gives us a way to put a number on where you're at, and it allows us to see progress. Now, we do have a lot of people who have had therapy for other issues. So say, after a knee surgery, for example, and they have weakness in the muscle on the top of their leg or the quadricep. So you can use what we call electrical stimulation, is what most people have heard it called, or neuromuscular electrical stimulation. And what that does is it helps to engage more muscle fiber with each contraction. So it helps to speed muscle strengthening in a way. And that is a treatment modality that we do have available if it's appropriate for the patient. So a lot of people come in and they've Googled it, and they've looked at lots of different treatment options, and they're appropriate for some people and not for others. But that's definitely something that we discuss with the patient once we get them in here for that first visit and really get an idea of what issues they're having.
So I don't know. Okay, let's describe the pelvic floor area. Okay, I mean, is it right below the belly and below the vaginal area, or what actually would you consider that area?
So it's low, and I don't have my model with me here. I'd show it on the screen because it's the first thing I grab off my shelf is the model. So most people have no idea that there's muscles down there, and it's eye-opening for a lot of people. So the pelvic floor is a big bowl of muscle that sits inside the pelvis. So every major organ down there goes through there. So the urethra passes through the pelvic floor. The vaginal canal goes through the pelvic floor, as does the rectum. So it's very low. It's lower than, if you would look at where you would put a belt, it's lower than that. It goes on the inside of your pelvis and is responsible for keeping you continent and is responsible for holding up your entire abdominal cavity. So it doesn't get a whole lot of credit for what it does, but people don't realize they have it until they're having a problem.
So after childbirth, okay, do the majority of women have an issue with that, or? or not?
Well, so do they know that they have an issue until they have an issue is my answer to that.
Okay.
So in the UK, all women are seen by pelvic floor therapists after every delivery. It's a standard of care over there, because if you fix the problem before it becomes symptomatic, then you won't have as many issues down the road. So a lot of times I'll see women, and we've tailored this broadcast, not so much pregnancy related, but it applies. So if you have a woman who has a child, 2 years later has another child, say they have another one after that, the issues that were present from the first one, so hip weakness or pelvic floor isolation and endurance, that doesn't miraculously get better after you have a child. Then people will start to notice that they leak a little bit, and it becomes something that some people think is funny. I laughed so hard I peed myself. Well, then the problem is that same weakness rolls into the next pregnancy, and now those compensations that your body has started using because of the muscle weakness gets worse, and then it gets worse, and then before you know it, you have organs falling out. And I tell people all the time, you don't wake up one morning when you're 50 years old and have a prolapse. It's the result of issues that started as childbirth. And I tell women all the time, I don't care if you're 50 or 60, your body is still postpartum. If we didn't fix the issues that started after you had a child, that weakness in the muscles of the pelvic floor, as well as the muscles in the abdominal wall, those are what help hold everything inside of your body. And if we don't make those muscles function like they're supposed to, things will start coming out. And that's kind of where we get there. So I tell people that the earlier we can treat it, the faster and easier it is, but it's never too late to make improvement.
So the poor woman, you treat it the first time, then you treat it the second time, and you treat it the third time. So nothing falls out. Is that
Right.
the kind of interesting situation here?
Well, and it's much easier when you're taught how to fix the problem when you don't see symptoms yet. So when the symptoms are minor, I might need to see that person 1 or 2 times, and then I'll catch up with them again after the next delivery, just to make sure how well is that muscle strength functioning, how strong is their abdominal wall, do they know not to hold their breath with things. You'd be amazed how much people hold their breath with things. Pay attention throughout the course of your day. Opening up a new gallon of milk, opening up the refrigerator door, picking up your groceries of a laundry basket. Every single time people hold their breath when they do these things, and it puts a lot of pressure down through the pelvic floor. And that pressure goes down, you don't have the muscles to come up to support it. That's where you start to see issues as people get older.
Amazing. Okay, our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. We are talking this morning with Altman's physical therapist. Lost your name, Darla Schwab. Sorry. So go ahead, Brad.
I was just thinking, we had a couple years back, we had another Altman physical therapist on who presented us with a very interesting concept, and it had to do with how they deal with the stones in the ear for people that get dizzy. And I just think it's neat that you have these different specialties at Altman, where you've got your pelvic floor therapy and you have that balance, vestibular balance, and it's just stuff like you never heard of before. And it's, I guess that's what makes this type of exchange so rewarding when you join us, is that we learn about something new. So when a patient walks in the pharmacy and if they say, oh, I'm having all this problem, can you point me to the depends? We could say, hey, maybe you need to think about talking to your doctor or learning more about this particular issue. So at the break, I was kind of wondering, you've described a lot about how important it is to keep those muscles strong. And I think we can envision going to the gym and doing different exercises with machines and things, but what's a garden variety exercise that you have a patient do that might help strengthen the pelvic floor for them?
Yeah, so when it's appropriate for the patient to learn how to contract these muscles, I start with a verbal description. So I tell the patients, especially if you're sitting down, because that's the position that you're in, sitting or standing during the day. Think about trying to stop your urine flow. And when I say that, I say think about, okay? A lot of patients will try to sit on the toilet and start and stop their urine flow. And that is not what we want you to do. That can cause other issues that we don't want to have to deal with. So can cause urinary retention or even an infection. So we don't want to see that happen. But that example for a lot of people helps them envision that in their mind of, oh yeah, I would try to do that. But I tell people no one should know that you're doing it. So that means if you're clenching your tush and you come up off of your chair, an inch, that means you're not doing it right. You shouldn't feel any kind of contraction on the inside of your thigh. And then people will hold their breath when they do this as well. So, and when I teach them to do it, a lot of people try to hold this for 5 seconds. The issue is they're not ready to do that yet. So a lot of people who come in here, they were told to contract and hold for 5 seconds and do that 15 to 20 times a day. And the problem for most patients is they're not strong enough to hold it for 2 seconds yet. So holding it for 5 seconds is pretty challenging. They're going to get frustrated because they don't see improvement and then they stop. So I teach people to start with trying to do 3 in a row. So when they're sitting there, try to turn it on and off 3 times in a row. And without going into physiology, the muscles that are responsible for helping you maintain continence with things like coughing and sneezing, these muscles need to contract hard and fast, okay? Contracting and holding isn't going to help those muscles because it's not contracting and holding that's the issue. It's when you cough and sneeze, these muscles can't go from off to on quick enough to keep them from leaking. So I start them with 3 of just sitting there on the toilet, contract, relax, contract, relax, contract, relax. And that is challenging for a lot of people because they've never had to turn these muscles on and off. So then we go from there. And some patients look at me and they say, I have no idea if I'm contracting these muscles right or not. And I say, okay, then my suggestion would be an exam because then I can tell if you're doing it right. And I can put a number on how strong that contraction is. Some people would rather be hands off and I never even touch that patient. I teach them how to do those contractions. We see what is an appropriate number for them to do during the day and we go from there. That's why we try to keep things more customized to the patient because that's what's going to see more improvement. And then we also, as we talked about earlier, we'll start into core strengthening, typically that second visit. And I'm not saying sit-ups and planks and crunches, which is what most people think when I say core exercises. I'm talking about the deep core muscles, the ones that give you support and are they're the closest muscle to your internal organs. So this is the muscle that's responsible for maintaining that pressure and compression in your body.
That's really interesting. And I'm thinking about that as you describe it and thinking about how challenging that must be. So that's very interesting. Okay. So I'm thinking also, I think physical therapy. So you describe those exercises that could be a little tricky to know if you're doing them right. How much re-education do you end up doing with patients? Because I'm kind of wondering, if you tear an ACL and you go home or you go to PT and they give you some exercise and they say, work on this at home, not everybody does their exercises at home. So how many people do you get to follow through with your exercises that you send them home with? And then how do you know if they're doing it right? Do they see improvement fairly quickly? Is it a couple weeks, couple months? What's a garden variety? I know everything is customized, but what's a garden variety response?
So my patients are extremely compliant, which is great because they're not just dealing with, a knee or a shoulder that's bothering them. They're dealing with, I'm tired of peeing my pants every time I try to play with my kid, or I can't go do this with my grandchild because I'm going to leak. So, and I also make it doable. So when I have a patient who leaves my office, they're not leaving with more than 3 things to do. Okay. So I keep it short and sweet. The other thing is I have 3 young children. My life is chaotic. I have to figure out how to multitask to get anything accomplished. So I tell people, do your exercises when you're doing something else. So for example, those 3 contractions, I tell my patients to do those on the toilet after you're done going to the bathroom. Why? Because you're dealing with that part of your body anyway. You've already voided and emptied your bladder. It literally takes 10 seconds and then you go on with your day. So you don't have to add one more thing to your day to remember to do. If you do it right after you pee, go on with your day. Normal urinary frequency is between 5 and 7 times a day. So if you do that 5 to 7 times a day, you see good improvement. And people are pretty impressed by how fast they can see reduction of these symptoms, especially urinary urgency. So not just running to, not just leaking when you cough or sneeze, but also leaking when you're trying to get to the bathroom. That's another condition that we address, partially with pelvic floor strengthening, but people see improvement pretty quick. I'll normally have people in here and then I'll have them come back in about 2 weeks. Why? Because in 2 weeks, they're going to see at least 25% reduction of symptoms typically. So, and they're pretty happy with that. They look at me and they're like, wow, I did my exercises and I see improvement. I said, yep. So typically people are pretty compliant and I try to keep it pretty short, sweet, and easy to make it happen.
So I can't help but in the background think, if more people were able to get training and support by a specialist like yourself, are you going to put Depends out of business? I mean, how many people have problems because this is the true cause is what I'm thinking now.
Right. Well, I mean, and they're a $1 billion business. Incontinence products are a multi-billion-dollar business a year. And it's because of this. I mean, can I prevent every person from leaking? No. But can we make pretty significant strides? Absolutely. And the problem is people just don't know that there's help available. And the other issue is there's not a lot of us around. I had my first child 7 years ago. I had issues after he was born. And the closest pelvic floor therapist to here at that time was Barberton or Hudson, which is a drive. And they didn't accept a lot of insurances that are accepted down here. So I was young, I was healthy. And that's what really opened my eyes to, if I'm having those kind of issues, how many other people around here are having those kind of issues? So then that kind of just spiraled into, now that's all I see. And over the course of the past 5 years, I've cared for just over 5,000 people locally, and not even just locally. I have people that drive from as far as Boardman. I've treated patients as far south as Denison and as far east as Medina, because there's not a lot around here. There's not a lot around, and I mean, we're adding. There are more therapists popping up, but it takes a lot of time. It takes a lot of time to get experience in managing these patients. So now that I'm here with Altman for the past, I'll start my 3rd year here in January. I'm happy to be part of a big program that can reach more people in this community.
Well, Darla, we need to wrap up quick here. So how about you give us your contact info for listeners? Yeah,
so we're at the Altman North location off of Whipple. The phone number is 330-244-8113. And patients can also email me. It's Darla, DARLA .Schwab, S as in Sam, CHWAB as in boy @altman.com.
Wow. Very interesting program, Darla. Darla Schwab, physical therapist with Altman Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsor, Studio Arts and Glass, Genuine Appraisals and Liquidation. And as always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy weekend. We'll see you right here next Friday on News Talk 1480 WHBC.